Hello friends, welcome to my channel Doctor Online 24/7. Today I'm going to tell you about tonsillitis. In this video we will cover Introduction, Causes, Types of tonsillitis, Symptoms, Signs of tonsillitis, Diagnosis of tonsillitis, Prevention, Treatment, Home remedies of tonsillitis. So let's get started. Introduction. Tonsillitis is inflammation of the tonsils, two oval-shaped pads of tissue at the back of the throat, one tonsil on each side. Signs and symptoms of tonsillitis include swollen tonsils, sore throat, difficulty swallowing and tender lymph nodes on the sides of the neck. Causes. Bacterial and viral infections cause tonsillitis. A common cause is Streptococcus, strep, bacteria, which can also cause strep throat. Other common causes include adenoviruses, influenza virus, Epstein-Barr virus, parainfluenza viruses, enteroviruses, herpes simplex virus. Some things may put you at greater risk of getting tonsillitis. Age. Children tend to get tonsillitis more than adults. Kids who are between the ages of 5 and 15 are more likely to get tonsillitis caused by bacterial infections. Tonsillitis from viral infections are more common in very young children. Elderly adults are at higher risk for tonsillitis too. Germ exposure. Children also spend more time with other kids their age in school or camp, so they can easily spread infections that lead to tonsillitis. Adults who spend a lot of time around young children, such as teachers, may also be more likely to pick up infections and get tonsillitis. Types of ton. There are 3 types. Acute tonsillitis. These symptoms usually last 3 or 4 days but can last up to 2 weeks. Recurrent tonsillitis. This is when you get tonsillitis several times in a year. Chronic tonsillitis. This is when you have a long-term tonsil infection. Symptoms. Tonsillitis most commonly affects children between preschool ages and the mid-teenage years. Common signs and symptoms of tonsillitis include red, swollen tonsils, white or yellow coating or patches on the tonsils, sore throat, difficult or painful swallowing, fever, enlarged, tender glands, lymph nodes, in the neck, a scratchy, muffled or throaty voice, bad breath, stomachache, neck pain or stiff neck, headache. Signs of tonsillitis. In young children who are unable to describe how they feel, signs of tonsillitis may include drooling due to difficult or painful swallowing, refusal to eat, unusual fussiness. When to see a doctor. It's important to get an accurate diagnosis if your child has symptoms that may indicate tonsillitis. Call your doctor if your child is experiencing sore throat with fever. A sore throat that doesn't go away within 24 to 48 hours. Painful or difficult swallowing. Extreme weakness, fatigue or fussiness. Diagnosis of tonsillitis. Your doctor will do a physical exam. They'll look at your tonsils to see if they're red or swollen or have pus on them. They'll also check for a fever. They may look in your ears and nose for signs of infection and feel the sides of your neck for swelling and pain. Tests to find the cause of tonsillitis may include a throat swab. Your doctor will test saliva and cells from your throat for strep bacteria. They'll run a cotton swab along the back of your throat. This might be uncomfortable but won't hurt. Results are usually ready in 10 or 15 minutes. Sometimes, your doctor will also want a lab test that takes a couple of days. If these tests are negative, a virus is what caused your tonsillitis. A blood test. Your doctor may call this a complete blood cell count, CBC. It looks for high and low numbers of blood cells to show whether a virus or bacteria caused your tonsillitis. Prevention. The best way to prevent tonsillitis is through good hygiene, including washing your hands often, not sharing food, drink, utensils, or personal items like toothbrushes with anyone, staying away from someone who has a sore throat or tonsillitis. Treatment. Role of well-known 4 tissues remedy in tonsillitis. Fair Foss, tonsils red and inflamed, painful on swallowing. This remedy at first alone. Callie Moore, the second remedy, as soon as there is an swelling of the throat. Throat spotted white or gray. Chronic or acute tonsillitis with much swelling. Callie Foss, tonsils large and sore, with the white, solid deposit on them, like a diphtheritic membrane. Nat Foss, catarrh of the tonsils with a golden yellow tinged exudation, from an acid condition of the stomach. Chronic swelling of the tonsils. Home remedies of tonsillitis. Get plenty of rest. Keep your humidifier on. Throat lozenges. Tea with honey. Ginger. Frozen drinks and popsicles. Thanks for watching. Doctor Online 24/7. By Dr. Sana Bawani.